So you've had a medial branch block, and they gave you a number, a percentage of relief, right? And that one number can feel like absolutely everything. Well, today we're going to pull back the curtain on that percentage and turn it from something confusing into a tool that actually gives you clarity. This is the big one, isn't it? It's the question that just hangs in the air after the procedure. You're left looking at this number, whatever it is, and just wondering, is this a green light for something like a radiofrequency ablation, or is it a dead end? Okay, let's dive right in. Our goal today is to knock that number off its pedestal. We're going to break down what it really means so you can use it to have a really productive, confident conversation with your doctor about what to do next. First things first, we've got to understand what that percentage is actually measuring. It's so easy to think of it as just a pass-fail grade, but the reality is way more nuanced and honestly a lot more helpful than that. So here is the most crucial thing to remember. Your percentage is a signal that your facet joints might be part of the problem. It is not a final verdict. Think of it like a snapshot from a single day. A day that could be influenced by so many things, from the meds you took, to how much you moved, to even the specific technique used. It just points in a direction, it doesn't seal your fate. Look, a pain score dropping from an 8 down to a 4, that's important. But what's arguably even more valuable is what that change let you do. Could you actually sit all the way through dinner? Could you drive for 20 minutes without wincing? Could you do a simple daily task that was impossible before? This is the kind of data that turns a number into something with real-life meaning. All right, let's talk about the big debate you'll see everywhere, from insurance policies to clinical guidelines, this whole fight between a 50% cutoff and an 80% cutoff to move forward. I mean, why does this debate even exist? Well, the reason this whole thing is so contentious isn't because one side is right and the other is just wrong. It's because the system is trying to balance two perfectly reasonable but kind of conflicting goals, and each one comes with its own set of risks. You can really see the trade-off here, right? A 50% threshold is designed to cast a wide net. It's trying not to miss anyone who might get some benefit, even if their pain is complicated. The risk? You might get more false positives. On the flip side, an 80% threshold is way more selective. It wants to be super sure the facet joint is the main problem to avoid procedures that won't work. The risk there? You might accidentally exclude some people who really could have been helped, creating false negatives. But here's the kicker. Just having a stricter, higher bar, like 80%, doesn't automatically mean it's more accurate. If your test day was noisy, if you were sedated or you didn't really test your usual pain triggers, you might not have given the block a fair shot, and a truly positive result could get missed completely. So that brings us to the most practical part of all this. How do you figure out if your test day gave you a clean, clear signal, or if it was just full of noise that's muddying the waters? These right here are the usual suspects. Sedation can totally change how you perceive pain. Taking extra pain meds might make your relief seem way better than it actually was. And hey, if you just rest on the couch all day and don't try to do the very things that normally hurt, well, you haven't really tested anything at all, have you? So here's a really simple tool. You can think of it like a clean block scorecard to help you audit your own procedure day. Just give yourself 0, 1, or 2 points for each of these items. If your total score is up there at an 8, 9, or 10, that suggests you got a very strong, clean signal. But if you're down around 0 to 3, that means the data is pretty noisy and it might be worth talking to your doctor about maybe repeating the block to get a clearer picture. And this is how you capture that clean data. Honestly, a simple, time-stamped diary is your absolute best friend. The most critical parts are the function test column, where you on purpose test a trigger, and the what changed column. This isn't about writing an essay, it's about creating data points that tell a really clear story. Okay, so we've got the percentage, we've got our functional data, and we've audited the quality of the test day itself. Now, let's put it all together into one powerful framework that can help guide your decision. The first point of our triangle is that percentage, but see, now it's not just a number you're vaguely trying to remember. It's an estimate that's actually backed up by your own time-stamped notes, which makes it way more reliable. The second point is that all-important functional change. And this isn't a feeling, it's a measurement. It's, I could stand for 10 minutes instead of only 2. Or, I could sit through that 20-minute drive. That is a concrete, real-world outcome. And the third point of the triangle is the quality of the block itself. How much noise was in the system? Were you sedated? Did your meds change? This context is what tells you how much weight you can really put on the other two signals. And here it is all together. When you look at your results through this lens, the path forward gets so much clearer. If you have 2 or more strong signals, like say a moderate percentage but a huge functional change and a really high-quality block, you have a very coherent, very strong case for taking that next step.
This quote really says it all. A 60% might sound a little disappointing on its own, but when you pair it with the functional win of cooking a meal for the first time in months, wow, that becomes an incredibly powerful signal. The number isn't the whole story. The pattern is the story.
Okay, we've covered a ton of ground. So what's the one most important thing you can do right now to put all of this into practice and really take control of the process? Here is your plan. 3 simple steps. First, call your clinic and ask for a copy of your procedure note. That gives you the technical details. Second, really fill out that 24-hour diary to capture your personal experience. And third, bring both of those things, plus the 3-signal triangle, to your next appointment. This completely transforms the conversation from, so what does my percentage mean, to here's my complete data, let's decide on the next step together.
And that really brings us to the final thought. In the end, this isn't about chasing a percentage. It's about what that relief allows you to do, what activity it allows you to buy back. So what is it for you? Is it walking the dog, playing with your grandkids, just sitting through a movie with your family? Keep that goal front and center, because that is the true measure of success.